Welcome to Plastic Surgery Videopedia. Today we have for you a video of Dr. Alfonso BARRERA on the faculty at Baylor University College of Medicine, showing us how he does and his thoughts about hair restoration. He's made great progress in this operation, which is a tremendous benefit to plastic surgery and to people everywhere. And it's a joy for me to be able to present to you his work. Now, Alfonso, this video is just fabulous. Tell us, however, some of the negatives. Do you ever have any kind of problem at all with this? Tell us about that.
Well, the main thing is to pay attention to patient selection. You know, there are patients every now and then that you'll find that just don't have quite enough donor hair. We need to pay attention on the supply and demand factor. The area of supply being the donor area, the area of demand, the area that needs hair transplantation. To date, we cannot make new hair. We're only relocating hair from one area to another. So if someone is limited in donor hair, those, better we just, if it's limited and they have limited expectations, you can still do them. But if they are very limited, forget about that. It is very safe, but it's also very important, like in other aesthetic procedures, to give the patient realistic expectations. You are not going to be able to accomplish the density they once had when they were 18 or 20 years old, only redistributing what they currently have. Additionally, I should say also, as far as the donor side, complications can occur if you take a strip that is a little wide, and as you attempt to close that, if there's tension at the closure, there's going to be some ischemia, and that's going to result in a widened scar.
You mentioned that in the video, and I think that's a good thing for them to know. Be very careful about not taking too large a piece. Tell me about after surgery. When do they wear a cap, or do they wear a bandage, or what do they wear after surgery, and how long do you feel as if they need to have it covered?
I have them wear the bandage for 2 days. It's basically an adaptic, Curlix, and an ACE bandage. And on the second day, I have the patient remove the bandage and gently start shampooing. Mm-hmm. From that point forward, they can shampoo daily. They have to be gentle the first few days, just very gentle shampooing. If the water of the shower pressure is too hard, better use a cup. Mm-hmm. And at the end of the showering, they may blood dry with a towel, but wouldn't want any friction on the scalp. Mm-hmm. And then about the 10th postoperative day, we remove the sutures. It's a 3-O-Proline, we remove the sutures. And it takes about 3 to 4 months for the hair to begin to grow. Mm-hmm. It takes about 6 months for it really to make a significant improvement, and about a year for the final result. Mm-hmm.
So about how long do your patients wear a cap after surgery when they go out socially?
About 2 weeks.
Mm-hmm.
About 2 weeks.
So after 2 weeks, a person in business or a person with a social life can appear without the cap, without it being too conspicuous.
Yeah, I think 2 weeks. Occasionally someone who is very fair complected, it may look a little bit pink, the area grafted, that they just have to deal with that. It looks like a sunburn sort of thing.
Mm-hmm. How many people have you done hair grafting on?
About close to 2,000.
About 2,000. I think that's enough to feel as if you know your way around.
Well, thank you.
Okay, thanks very much. And now we're going to see this fantastic video.